Here on Steel and Vance, a couple of unicorns over here, COVID unicorns, because both of us have never had, I know, touch wood, we have never had the symptoms and tested positive. Who knows if we've ever actually been asymptomatic cases of COVID. But
and yet I know so many people who are saying that they have not been able to get rid of the symptoms.
Right.
So they have the classic long COVID, which manifests itself in many different ways. There's a lot we don't know about it, which is why there is now sort of crowdsourced research project going on where they're trying to encourage anyone who has long COVID or thinks they do to go onto this website, which we're going to tell you about in a second, so that researchers can learn more about long COVID. What does it mean? How long does it last?
What are the symptoms? How many are there? What should we be thinking about? Who does it happen to? Thank goodness we have an expert
questions
here.
We're about to ask our next guest. Dr. Karen Tran is a UBC COVID researcher. Thank you so much for joining us.
Thank you so much for having me.
We've been bending your ear for a few minutes here prior to the lights coming on, as it were, and there's so much to cover. It's hard to imagine we can try and do it in 5 minutes or so. But within your research study, my first question would be the length and breadth, I guess, of what a long COVID symptom even looks like.
So generally, we know that long COVID symptoms can generally persist for at least 3 months.
Okay.
And they are very debilitating. People often aren't able to go back to their day-to-day function because of that.
So things like what? What are the most classic symptoms? Because I think you said there's a couple of hundred?
Yeah, there's over 100 symptoms, but the most common ones we know is people feel very short of breath. They're really tired. They have a lot of muscle weakness and joint pain. And they also have a lot of difficulties with concentration and what we call brain fog.
So if somebody is feeling the effects, whether they had a mild case of COVID-19 or if they had a severe case of COVID-19, is there relevance? Like if somebody tested positive and barely felt anything at the time, but then is showing some of these symptoms that you just explained, would they perhaps be part of your research?
Exactly. So what I think was most surprising and what I think your audience will find interesting is that people, regardless of how they presented, can present with long COVID. It's such a variable presentation and people just respond so differently. So that's why it's so important for people to go onto the website, complete the patient scientist survey, and so we can really understand what people living with long COVID are going through, what symptoms they have. So we're really able to come up with a good treatment plan and develop care plans for these people.
There's the banner up there.
Get your pencils out.
PatientScientist.ca. That is the portal to go to sign up and start to talk about your own symptoms. But we were talking earlier, and one of the things you said that was interesting is we're trying to figure out who normally gets long COVID. And unfortunately, it is older women.
So we know traditional risk factors are women are more likely to get it, people who are older, and people who have more medical problems such as high blood pressure or asthma. But oftentimes the studies are done in patients who are older and sicker to begin with, so we don't really know how it affects everyone. So that's why it's so important for everyone to go onto the website and put down their experience so we can get a better understanding of what risk factors.
So these are the things that you're pulling in as this crowdsource. So you can go in and you can give as much information or as little, how when somebody's worried about maybe privacy concerns or how it might impact their lives. What is that form like for somebody who's logging on?
So these questionnaires are the same ones we administer in our post-COVID clinics, and they're all protected by privacy.
Good to know.
People can enter as much information as they want in their symptoms. They can always come back and complete the survey. They don't have to do it all at the same time. And what's really interesting is that people can compare their symptoms. So people can compare how they're doing compared to other people who've entered information in the website, just to kind of gauge to see how they are in terms of other people with long COVID.
What do you say to people who go, "Oh, COVID, it's just a cold, it's no big deal, you just move along"? This can sort of manifest from something that starts as just sniffles, can turn into something more serious.
For sure, and I think that's what's the most surprising thing is that people just present so differently. People can have a very mild infection, never needing to be hospitalized, and then they develop very severe long COVID infection and symptoms, and they're just not able to do their day-to-day activities.
As a COVID researcher, is there any information where vaccines are concerned? Like, if does fully vaccinated and boosted matter when it comes to long COVID? Is there any correlation between that level of protection and long COVID?
That's a great question. They're still needing a lot more research for that, but what we would still recommend is everyone still get their vaccines and get boosted.
Right, protection
Absolutely.
better. Yeah.
One of the things that we're hearing in the news is an association potentially with microclots and COVID. What do you know about that?
So I think why some people get long COVID and others don't, we still don't really understand. We don't really know what the mechanisms are, and hopefully by people who are living with long COVID contributing their experience,
Right.
we'll be able to develop more understanding of why people are getting long COVID and how is this happening.
So when it comes to what you're collecting, just so I understand this properly, because long COVID is when you've had symptoms post-infection for longer than 3 months.
Exactly.
And it can then go away at any time, and that's still considered long COVID. So you want anybody who felt the effects of their infection beyond the 3-month mark to log on. Derek, can we put up the patients scientist.ca again, just so people grab your pencil, because if you've had COVID-19, write this down and be a part of it. I think your research is so important. So it's not just about people who are suffering long COVID, ongoing, never ending. It's about learning everyone's experience, right?
Exactly, and I think this is such a great, unique experience where people are with lived experiences with long COVID can really contribute to science.
Right.
And so I think together we really want to make sure that we address what's really important for people who have long COVID, so we can really create the best care for them and really discover new treatment options.
We're going to have to follow up with Dr. Tran for sure.
Good luck to you with it, and thank you so much, because there's so many questions around COVID that we don't know. Thank you so much for making time to join us.
Thank you so much for having me.
Dr. Karen Tran, a COVID researcher at UBC. We got a lot of things coming up. We have what the hell?
What the hell is wrong with people? There are a couple things in what the hell that you don't want to know about, but we're going to tell you anyway. Yeah. And we've got a really cool fan, but what the hell is this?
Yeah, the Conservative Party has a brand new horn-honking, convoy-loving director of communications.
Okay.
What the hell's wrong with people when we come back?